everyone. Welcome. I'm Christine Salas, the HTPA Community Director, and I want to welcome you to the HTPA Healer Development Series to deepen your healing touch practice. And today's topic is on surgical support. We have an amazing panel today of practitioners and instructors to share their knowledge, skills, and expertise with you on using healing touch for surgical support. A few things I want to mention. We are recording this event, and so I ask everyone listening in to please mute yourselves so we can hear the wonderful things our panelists are going to share with us today. And the recording usually will be put up on the HTPA member portal in about a week, and so you can look for it there. We will have an opportunity for questions, and so we'll save those to the end. And I will ask you to put your questions into the chat box when we get to that part of the agenda. And I ask you to please, when you send your questions, send it to everybody, because it's nice for everyone to see the questions as opposed to just sending it to me. And now I want to introduce our lovely panelists. So we have Chris Kaufman. Chris has been a registered nurse for over 40 years. She is a retired certified holistic nurse and a healing touch certified practitioner. She recently closed her private practice, Healing Touch Bloomington, after 10 happy years. She is a writer, a musician, and loves reading, gardening, and long walks in the woods. Welcome, Chris. Happy to have you here with us.
Thank you.
And then we have Heather Talley. Heather has worked as a surgical nurse for over 35 years in a large teaching hospital system in Willington, Delaware. She began her healing touch journey in 2011 and became certified in 2014. During that period of time, Heather actively sought to bring awareness to healing touch in the peri-operative setting. Heather has been a speaker at several hospital-sponsored symposiums and organized an introduction to healing touch presentation for the AORN local chapter in 2017. Currently, she is assisting with the rollout of the integrative care program at her hospital, with healing touch for nurses, including level 1 education being the initial focus. In addition, she has practiced and instructed both Taekwondo and traditional yoga philosophies and is a dedicated student of Tai Chi Chuan. Heather's personal and professional development remains a priority, and she explores healing touch for animals and embraces opportunities to expand with online courses offered by HTPA and the Association for Comprehensive Energy Psychology. Most recently, her interests have expanded into understanding brain wave states and applications of sound frequencies to the art of healing. Welcome, Heather. Happy to have you here. And then we have Linnie Thomas. Linnie is an award-winning author of the Encyclopedia of Energy Medicine, Laws Governing Energy Medicine Practitioners, Pioneers in Healing Touch, and There Is No Hell. A certified spiritual healer, diplomat of earth stewardship, and ordained minister with the Assembly of Spiritual Healers and Earth Stewards, she is now a full-time author, student, and instructor in the healing, metaphysical, and spiritual fields. Linnie holds certification both as a practitioner and as instructor for Healing Touch program. She has studied more than 100 energy healing therapies and conducts workshops and lectures about energy healing and communication with spirit guides. Welcome, Linnie. Happy to have you here with us today. So as you all can see, we have some great practitioners and instructors here on our panel, and I'm looking forward to hearing all that they will share with us today on using healing touch with surgical support. And I'm going to let each of them just share a little bit more about themselves, and particularly also sharing their experience in using healing touch with surgical support. And Chris, you can start us off, please.
I'd be glad to. I'm very honored to be in this presenter group that's very seasoned. I feel like a little bit of a lightweight in comparison, but I'm tired today because I got up at 4 a.m. Wednesday to take a friend to her hip surgery. So I'm right in the groove of doing this work at this moment. I had a career as a teacher first and then went into nursing in my 30s, discovered holistic nursing in my 50s, and then found in my 60s the thing I was really on the planet to do, which is healing touch. I took my first 3 levels from Sandra Lutz in Pekin, Illinois, who was an early proponent of healing touch and worked with Janet Menken and many of the other early luminaries that we read about. She is still very vital at age 85 and was just doing classes until 3 years ago. She looks like a benign quilting granny, and she always has been, but her family really has no idea how she's tied into the universe. So I was very honored to be working with her. I'm a yoga practitioner. I've had Reiki training and also level 1 of healing touch for animals, which is just a wonderful thing to do. So that's my story at this point.
Great. Thank you, Chris. And how about you, Heather?
Well, hi, everyone, and it's really a blessing to be part of this panel today. I'd like to open with a declaration, and that would be that I love surgery. I fell in love with the operating room when I was 18 years old, and I was hired at Christiana Hospital in Delaware in 1986 as a surgical tech when I was 20 years old. So I have very literally grown up as an OR nurse, and I still work in surgery today at Christiana Care in Delaware, which is a conglomerate now of 3 teaching hospitals, one of which is the only level 1 trauma center in Delaware between Philadelphia and Baltimore. And from what I understand, without giving you numbers, we have among the busiest volume of surgical services in the country. So needless to say, I've participated in a lot of operations over the past 36 years. So I was introduced to healing touch through an email in the hospital. And that was about a level 1 class that was being taught at AI DuPont, Nemours, where I met my first instructor who became my mentor, and that would be the trailblazer Wally Adams Gertz, who I'm sure is on this call with us today. Without her, I would not be where I am today in terms of healing touch. So I've had a few private clients in a very humble practice of my own, which has now been on the shelf since the pandemic came into our world. And I've also had an opportunity to see a few people through the surgical process at their request, which was very exciting and a wonderful opportunity to see somebody through from the initial planning stages of surgery through the admission, through the intraoperative phase, and post-op. And so currently I'm working with a friend and a fellow HTCP who is also a nursing colleague at the hospital, and she is now the nurse manager of the nursing integrative care program that was mentioned in the bio. So in addition to that, I also have a project of my own at the hospital in the OR, which is about creating a dedicated space where we can offer mini healing touch sessions to the staff at work to support their work-life wellness and balance, which is really an exciting thing to be a part of. And what I hope to bring to this panel today is a glimpse of my intimate understanding of how things work behind those double doors, and my longtime fascination with the idea that healing touch can truly be an adjunct to surgery in progress, which is a place that is very close to my heart. That's what I've got for you.
Thank you, Heather. And how about you, Linnie? Oh, Linnie, you're muted.
There. I assume you can hear me now.
Yes.
Good morning, afternoon, evening, wherever you are. This is a wonderful opportunity, and I'm excited to be here. Working with surgical patients is one of my favorite things to do. I started in Healing Touch in 1997, and Barbara Dahl was my instructor for levels 1, 2, and 3, and is still one of my very dearest friends. Love her very much. And she was a psych nurse, but she had a lot of surgical experience as well, which she shared with us in my early classes, which helped a lot. Most of my experience with surgeries are from my own clients through the years, and I've been in several states now doing surgical work. I guess you could call it, I call it pre-op and post-op because I've never been in an actual surgery. In Oklahoma, I had absolutely no trouble getting into, oh dear, the word post-operative surgery. I hate it when I have a senior moment and I'm in public.
Recovery?
Recovery. Thank you very much. I appreciate that. Step in anytime. Anyway, yes, I got to be in the recovery room, and I was delighted with how much I was welcomed there. Here in Oregon, where I live, I've been in the recovery room a couple of times because my client insisted on it and informed the authorities that if I wasn't allowed to be there, she wasn't having the surgery. So sometimes our clients are our best advocates in this type of work, and I find it humorous. And the first one who did that, my goodness, she had come to the Pacific Northwest for a surgery, and she lived in Baltimore. But we had the reputation of being the best at that time for her type of surgery. And 4 days later, even though she was in a wheelchair, she was visiting Powell's, which is one of the biggest bookstores in the country. So it shows how well she was doing afterwards. And that was early in my career. I think I was in my second or third year as a healer practitioner. And I just realized how powerful and how strong and how important this work is in surgery. So I think that sums it up. I have a lot of different hats, but I wanted to just stick with the surgical one today.
Thank you, Linnie. Okay, so moving on to our first question is what common intake, assessment, and energetic patterns, if any, do you find in clients that are needing this surgical support? And I'm wondering, Heather, if you could start us off there.
Sure, I'd love to. But first, I'd like to describe a sequence of events that is standard and specific to the perioperative, meaning the time that surrounds the operative experience for patients, in order to break this down and categorize it into 3 different parts for clarity as we move along in the questions. And this kind of shows the acute transitions that happen for somebody once they step into a place where they're going to have a procedure. The first one is the preoperative phase, and that's where the intake and assessments would typically take place. The second is the intraoperative phase, and that's the phase of being inside the operating room. And the third is the post-op phase, and that's kind of how Linnie referred to. That's the time immediately following surgery in the recovery room. So this question that we're addressing right now is specific to the preoperative setting. And if you've ever been a patient in surgery or accompanied a loved one to the hospital for a procedure, you kind of know the drill, right? You arrive at the hospital, you haven't had anything to eat or drink since the night before. So you're hungry, and there's your root chakra. And next, you're stripped of your clothes and your personal belongings. You're put on a hospital gown, and you're feeling a little bit vulnerable and exposed. And there's the sacral chakra. And then next, you're waiting, you're laying on a stretcher, and multiple people are coming in and out of your space, asking you the same questions over and over again. And you may start to wonder, what's happening here? And do these people know what they're doing? And then you may get a little bit frustrated. That's a common thing that people feel in this environment. So now we're talking solar plexus chakra. So already the lower 3 chakras have already been hit pretty hard before we even get into surgery itself. So we know that every patient is a custom job. Every client that we see in a practice is an individual with any variety of pre-existing energetic assessments is a probability, right? And these assessments can be found in all levels of the system. And these assessments can be related to the diagnosis that's being sought. Perhaps we're going into surgery to biopsy something or look into something, or perhaps it's a treatment for a condition that's already been diagnosed, say a thyroid or something. We could be in the OR to fix broken bones or treat other injuries or conditions that need repaired. Joint replacements is a big one that comes to my mind. And then we also need to consider that body images are about to be altered, even when it's by choice for, say, an abdominoplasty, a facelift, a breast reconstruction. So I would anticipate anyone coming in for surgery for their field to show a reflection of an activated sympathetic nervous system. And I also want to point out that in this hospital setting, it is relatively unavailable to use pendulums or hand scans to get that pre-energetic assessment. So in this environment, we need to use other skills, which really boil down to attuning to the energy of the patient, to the energy of the room. And this way we can see how we can adapt healing touch practices to this environment.
Great. Thank you, Heather. And Linnie, could you add to that?
My clients who've had surgery are usually people I've worked with a long time ahead of time. So I know pretty much, I've seen how their condition has progressed to the point where surgery is the most viable opportunity for healing. And so I'm documenting pain spikes, changes in the field, whether usually it's more dense around the area that's got a problem, things like that, for sometimes months in advance before surgery is finally done. And then I'm there first thing in the morning with them. I get there about 15 minutes after they arrive. I don't do any documentation while I'm there. I might in the waiting room, if the surgery is about an hour long, I'll wait with the family. If it's going to be 5 or 6 hours, sometimes I'll go home. Sometimes the family wants me there the whole time, depending upon how serious it is. But that's a good time to do all my documentation. I don't like to do it ahead of time. In the hospitals I've been in the Portland area, there's been no problem with doing a hand scan. I haven't ever used a pendulum within sight of anybody, except maybe my client. I have been known sometimes to discreetly use the pendulum by holding my hand over the chakra, and then the pendulum will be below the bed in case somebody walks in, because there's always a time there where the client is all by themselves waiting, and they really love having me there. We're more of a source of comfort at that point of time in the pre-surgery stage than in any other time. And I like to do the chakra connection during that time. And I also have them do things. I give them assignments so that they have some feeling of control over their own situation, and they're not just sitting there feeling helpless waiting for other people.
Great.
I can talk about that maybe a little bit more later on.
Great. Thank you, Linnie. And now, as far as the healing touch techniques that you commonly use with these clients, and what your rationale is for using those techniques, Chris, could you talk a little bit about that?
Absolutely. I don't have the pleasure of working in the surgery room or in recovery. In a very allopathic area, and it's hard going to get these sorts of things in place. So You're not supposed to covet your neighbor's situation, but I am so envious of Heather, your situation with your integrative care program. And, you know, we're very lucky we're moving forward, but it's sometimes hard going. I find that, as each of the others have said, it's hard to assess discreetly. That's a nice word for it. And I have found ways to use a pendulum when there's nobody in the room post-operatively. It's helpful to see what's going on. In general, the two treatments that I think work 90% of the time for any problem are a full body connection and magnetic clearing. I really think that most everything that is particular in a problem that a person has can be cleared and balanced by balancing the whole system. So that is what I would recommend for that. When I had my practice and people wanted care before and after the surgery, I had a package that I used, and preoperatively, the night or the afternoon before, even in person or remotely, any modalities that would relax and clear the person so that they would sleep well and be relaxed. And often they would say they'd slept very well and they were not very nervous in the morning. And right after surgery, as soon as they got back into a room, since I was not able to be in recovery, trying to assess them as soon as the room is available with a hand scan and excuse me, clearing the room with intention. The intention, of course, being always to create a healing environment for the person. Whatever it seemed at the time was most important. Now, 48 hours ago, what seemed to be the most important thing, the only chakra that seemed to be impaired was the left hip, which had just been surgically changed. All the other chakras were spinning open and rather well. And I was pleased by that, but a little surprised too, because depending on the age and condition of the person and the surgery that happened, that's not always the case, as we may know. It seemed that magnetic passes, magnetic clearing was what she needed. Her blood pressure was elevated. And in 15 minutes of doing magnetic clearing, her blood pressure was down 10 points. And she said it was very calming. She was quite sentient at that point, quite alert. She'd had a spinal and a little touch of Versed. So she was doing well with that. I find that it can be helpful if one is there the rest of the day, besides clearing the anesthesia and retaining the pain medications that have been introduced through a spinal or whatever, some sort of internal pain block, which is commonly used now, to just see what's going on. Sometimes it needs more relaxation. Sometimes it needs to be particular treatments in the area that was surgical. For a hip replacement, one could use ultrasound and motion, perhaps a pain drain. And if it's a brain surgery, I would recommend that you not focus on the brain, to let that area be still and not be too interrupted with other energy. That's just a personal experience that I've had in talking to some doctors and two people who have had brain surgeries. The full body techniques seem to be more helpful there to allow the brain to rest and to accommodate to the changes that have been made. And the goal always is to reduce stress, to deal with pain. Some side things, you can energize the IV equipment and the IVs and piggybacks. That can be a very effective thing. With just hands still around them, you can energize any other machinery that's in the room. You can do a little work surreptitiously to clear the room, to make it a more healing atmosphere. Because as we know, it's a very stressful time. And the person's body has been attacked. It's a crisis that is physical and emotional and spiritual. And whatever we can do to heal that and to balance that is going to be to that person's good.
Great. Thank you so much, Chris. And Heather, could you add to that?
I'd love to, and I appreciate everything that Chris shared, and I may echo some of it. I'm going to go ahead and follow those 3 different stages of surgery. So in the pre-op area, the techniques that will be applied are based on what I would assume how the energy fields are presenting if it's unavailable to do an assessment. So healing touch interventions to clear, open, and balance, absolutely. Specifically the chakra connection to get everything flowing, to establish that energy flow and maintain that mind clearing, perhaps, for the anxiety and the stress, if there's time. And sometimes there's not enough chronos time to do something like this, so we can offer the intention for that to happen. So ideally, I've been thinking about this a lot in preparation for the panel, the idea of a spiral meditation preoperatively to prepare the field to prepare and open the field for the surgical intervention, to be receptive for the best outcome. Could be an interesting thing to look into and follow that spiral. And with the intention that that spiral will close on its own when it's ready, you know, using the idea that the energy has an intelligence of its own and will follow. So in recognizing that the pre-op area is not currently conducive in most places to an ideal healing environment, intake and assessment of the chosen techniques are not structured like a usual one-on-one session. And so we've mentioned that attuning to everybody simultaneously is an effective way of bringing the energy work into the area. In the pre-op area, I'll frequently stand at the foot of the patient's stretcher. We need to put on their compression boots, if anyone's familiar with those. Those are the pneumatic compression that assists the circulation while they're under anesthesia. And it's a way to disguise a grounding. So it's easy to slip that in an environment where there's a lot of eyes watching, not what any one of us are doing specifically, but something could be noticed. And it's a good way for me to slip it in. So intraoperatively, what techniques can we do? Well, it depends on, so I'll say me, it depends on my role. I could be assigned to be the circulating nurse, which is the nurse in the room who is not part of the sterile team, or I could be the scrub nurse. So I get to break this down in 2 ways for you all to help you understand. I get to do a lot more hands-on healing in surgery when I get to be the scrub nurse, and there'll be more on that in a minute. So when a patient comes into the OR, things happen fast, and time is being managed on a micro level. And once anesthesia begins, it's a completely different energetic assessment, I believe. So my question about that is, what happens to the field when general anesthesia is given or any heavy sedatives are introduced to the body? And I'm just going to leave that for now as an open-ended question. So here's how I've applied healing touch most frequently intraoperatively. So through intention setting and holding the space for the team with the patient as the focus for the work. You know, I can intend to change the energy in the room so that it's bringing in the highest and greatest good for the patient and for everyone else involved. Which kind of means indirectly that I'm responsible for maintaining my own high vibrational state and to remain heart-centered and sending that heart energy to the team that's about to do some invasive work on a person. I've been guided to place my hands on the shoulders of the surgeon on his backside in tying up his surgical gown before he steps up to the field and grounding him before he begins. And that's actually come to me when a surgeon who knew about the healing touch that I was working with, just from conversation, and verbally expressed to me at the scrub sink that this was going to be a pretty rough case. So I have no way of knowing if that helped him, but I do believe that in some way that it helped him and it helped the patient. I'll also hold patients' hands while they're going to sleep during surgery. At the same time, I'll be assisting anesthesia with the airway. So I can place one hand on the patient's wrist, perhaps, and I'll be at their head, and I can place another hand at their shoulder and intend for this energy flow to continue smooth and congruent and soft. And then after the patient goes to sleep, it's my role to step back as the surgical team steps up. So as I step back, I can intend to hold that space again. There's a lot of this space holding that happens in surgery. And then, so to switch this, when I'm a scrub nurse, that means I put on the surgical gloves and the gown and handle the surgical instruments at the field. This is the best opportunity to get hands-on, and it's where the magic happens for me. If you can hear me getting excited, this is what I really love to do. So I've used magnetic clearing over my instrument table before we begin, just to clear any energies that may be residual from anybody else's operation, which who knows if it is or it isn't. But just like we clean and sterilize our instruments, we can also clear them. I've also got a front row seat for wound sealing. So when the surgery is finished and they finish sewing up the wound and I'm right there, I have the opportunity to place my hand on top of that wound while we're preparing the dressing and initiate wound sealing from the very moment that those skin edges come together. It's also the best place to initiate the pain drain, because I'm already standing right there with hands on the surgical incision. And this also helps the reversal of anesthesia and can easily be done without interrupting any of the physical tasks at hand in surgery. So then immediately post-op, while we still have the patient in the operating room, magnetic clearing, like Chris mentioned, we can't get enough of that. With all of the gas inhalation agents and the IV injectable anesthesias and the muscle relaxants and all the things that are used, there's probably in the body multiple layers of pharmacology in action that would require multiple passes. And then in addition, I always try to keep a hand on the patient, usually at their feet when they're waking up from anesthesia. Again, to help keep the energy flowing. Perhaps I believe that it does help to bring them back to consciousness if I'm holding onto their feet and maybe putting a thumb on that wellspring on the bottom of the foot to help bring them back into this consciousness. And that's where I stop. Thank you.
Wonderful. Thank you, Heather. So next, I'm going to ask Linnie to share with us just a little bit about how often and how long are you typically seeing a client, that maybe is post-surgery or pre-surgery, and the duration of those sessions. Linnie, could you share with us?
Well, usually, first of all, I want everybody to know I'm a non-nurse, so I'm looking at this from a little bit of a different point of view. But usually I'm with them, they'll come to see me as a possible alternative to surgery. And I immediately explain to them that it doesn't work that way. I'm a tool in the toolbox, but I'm not going to be able to cure whatever it is that's going on. And by cure, I mean remove the absence of symptoms. There's a difference between healing and cure. Cure being the absence of symptoms. The way I like to describe healing is when the client gets to a point where no matter where they are in their healing progress, they're ready to accept it and go on down the road and do other things. Their whole emphasis is no longer on the issue. So with that in mind, usually there's at least 4 sessions before the surgery happens. Then when I'm there in the morning and I'm doing a lot of things that the other girls are doing, and I totally agree with everything you said, but while I'm doing the chakra connection, I have my client talk to the different parts of their body, like the muscle system, the lymphatic system, the circulatory system, the bones. And with each one, we ask that system to cooperate with the surgeon for the highest good of the whole body. So rather than think of it being attacked, we're talking about this as something that is in the highest good for all parts of the body, from the toenail to the hairs on the head, to cooperate with the surgeon and with the anesthetist. And it gives the client something to do. And it calms them down quite a bit because suddenly they feel like they're in control. When we're done with that, then I have them talk to their guardian angels and have the guardian angels talk to the surgeon, to the anesthetist, to the surgical nurse, to everybody who is involved, and see them all working in harmony together for the highest good of the client. Then, as soon as they will let me see the client when they come out of surgery, I'm there. Lots of times I get to be in the room they're going to be in. They'll have me wait there maybe a half an hour before they're due to come out of recovery. On the few times that I've been blessed with being in recovery, I haven't felt that the work I did in recovery, with one exception, really was of any more value than my being there the minute they get into their room, and as soon as the nurses are done taking care of them, then I start working with them. Usually I see them 2 to 3 times more in my office afterwards, and it depends upon the surgery, because so many surgeries now are day long and they go home. And a lot of surgeries that I've worked with now are in outpatient clinics. So it's not like I'm seeing them every day. When I first started 25 years ago, it would be sometimes 4 days before they would leave the hospital, and I showed up every single day and watched the pain progress and that kind of thing. I can't think of a single one who didn't surprise the doctors and nurses at how low their pain levels were after a surgery. Yeah. And I don't know when the stories you want told about some of the experiences with doctors and other things, but let me know, because I've got a couple of them that are really fun.
Great. Thank you, Linnie. And Linnie, I'm going to let you continue with our next question about some common practitioner observations or evaluations that you find with these types of clients.
Okay. Usually as we lead up to the surgery, I can see that the pain spike or the congested energy, whatever it is around the issue, build up. And I know that surgery is going to be a very valuable tool in helping that person get well. So I can see it energetically. I'm more kinesthetic. I say see it, but I actually feel it. I can see chakras in the right light just fine, but when my hands are in the field, I can really feel a difference as it progresses. And sometimes I know they're going to need surgery before they do, but I never tell them that. I don't want to influence my clients that way. I want them to make their own decisions. I'm there energetically, period. I'm real careful about not making suggestions because I'm not a nurse. It's not in my field of practice, my scope of practice, to do that kind of thing. But lots of times I'll know ahead of time. There have been a couple of times where the issue went away and I have no idea why. Then afterwards, usually what happens is the client gets well within 3 or 4 visits, sometimes not even that, maybe 2. and they're ready to go on down the road. They don't need me anymore, which is a bit frustrating because that happens so often with my clients. They get all well and then I don't see them anymore. Does that pretty much answer what you're looking for?
Yes, thank you, Linnie. Great. And as far as common client feedback that you receive following a session or multiple sessions, Chris, could you talk to us a little bit about that?
Certainly. And of course, again, it depends on the situation and the surgery a person had. Sometimes the feedback can be fairly quick because the person is alert and awake and can indicate what has happened to them, the sensations that they have and what they feel. Preoperatively, people will say, I feel much calmer now, and I'm glad I had a treatment last night because I slept well. But very often, if a person has had a surgery that has them limited in their ability to move or whatever, after the surgery, it's going to be a while, and one relies on what the energy is telling you if you get to work with that person. I did have a person who had a thyroid surgery and was having difficulty talking, and I saw her the next day. And afterwards, she was able to talk clearly and was just amazed at that and told everybody in the world, except her doctor, about the fine results she'd had. And that is what happens much of the time. People have reduced pain, they heal more quickly, they're released from the hospital more quickly than expected. And their doctors will say, well, you've had the most amazing recovery I've ever seen. But the clients often forget to tell them that they've had energy work. And that's just part of the invisible work that we do, and we carry on and know that it's all good in any case.
Great, thank you. And as far as some like common plans that you make with clients, as far as referrals or growth work, self-care, Linnie, could you share with us a little bit about that?
One of the most common things I've run into is my client doesn't want to take pain meds. They've got all kinds of issues around them. And I talk with them about how there is a proper time and place to take them and to stay ahead of the pain to be sure and take their meds. Now, 3 or 4 days after surgery, they may not need them as much, but immediately after surgery, now is the time to take them. I have had a few clients, though, who never needed them. The healing touch work that I was doing, I don't know if that was their individual situations, their belief systems or what, but they didn't ever end up taking anything stronger than an aspirin. So that is what probably the most important thing that I can think of right off the bat, is to let them know that there is a time and place for pharmaceuticals. That's what they're there for. There is a proper usage and a proper time. And for goodness sakes, follow their doctor's orders, not just about pain, but whatever follow-up medication needs to be done, to be sure and do that and to take all of them, and follow the doctor's instructions along that line. It's funny, people have some really weird feelings about pharmaceuticals, and yet they have their proper uses, and it's totally okay with me that they use them. When I do magnetic clearing, because I see there's a question about this, I remove what is in the client's highest good, the energetic residue of whatever is there. So that decision isn't made by me, it's made by the client, whether they're conscious or unconscious of it, it doesn't matter. And most of it would be unconscious, but it's what the body needs to let go of in order to heal. That's what I help remove when I'm doing magnetic clearing, which is probably the number one thing, that and and pain reduction. I do not intentionally remove all of the pain because the pain reminds them that they've got a serious owie here, and I don't want them overdoing or over moving around. So I'm very careful about that. So that's why I like to say the highest good for the client is what I follow the rule of.
Great, thank you. Good point. And thank you for answering that question. So moving on to success stories. Heather, could you share with us some success stories that you've come across?
I'd love to highlight one particular patient from a few years back, and I'll call her Jane. Jane was already someone who was in the know about healing touch through our local community. And I'm not sure how, but she contacted me directly about her upcoming hip replacement. Got a lot of hip replacements to talk about today. So she herself started this process that really brought the whole team together to support the energetic work that she was looking for around her hip operation. So we were able to facilitate what she requested, and this is how it went. She talked to her surgeon at her pre-op visit. She told him about her desire to have healing touch in the operating room, and that she was working this out. He was all for it. Couldn't believe this. He gave complete permission. This is an orthopedic surgeon that we're talking about. Then communication was made to my OR manager, and arrangements were made for me to be in surgery with her without being assigned to be the circulating nurse or the scrub nurse. So my role in the OR for her that day was strictly to be the healing touch practitioner, supporting her through her operation. And so in the prep and holding area, the pre-op nurses were aware that something else was going on out here, but there was time for me I was able to find the time in this instance to do a formal energetic assessment and intake with her. And so I also want to point out that in that environment where I was not a part of what was happening pre-op surgery, I was there to support her energetically. I was also able to share a little bit about what was going on there with Jane and with the nurses that were working with her out there. So we had time to work in pre-op healing touch techniques in between the time that she was admitted and the time that she got her spinal anesthesia, which is pretty commonplace for joint replacements these days. So she got an opportunity to have a solid chakra connection without being rushed, and she had some magnetic clearing without being rushed and being focused. She also had a desire to wear headphones in the OR because she had downloaded, I'm going to just hold this up. She had downloaded this CD about successful surgery, and it was very important to her to be able to listen to these meditations intraoperatively. So that was part of what I did for her. As we went into the operating room, the CRNA is the nurse anesthetist. She's also someone that I've known for a very long time and has heard me talking about healing touch over the years. So the fact that the CRNA at the head of the bed was aware of what my presence was meant to do in the operating room lent to my ability to sit with her at the head of the bed and maintain her earphones, which was so important for her. And essentially what I did in surgery was hold that space that I keep referring to, and sending the heart energy to the team so that the surgeon and his assistants and the scrub nurse were able to do what they were there to do in the best way possible for the best outcome for this patient. Immediately post-op, I was able to administer that wound sealing and pain drain in the operating room and initiate the magnetic clearing of the anesthetic agents. And then I was able to stay with her in the recovery room for a while, doing more magnetic clearing again and hands in motion. And all of this was able to, we worked it in so that it was in between the times that the PACU nurses, the recovery room nurses, were doing what they needed to do in order to prepare her for moving up to the floor. And so I was also able to follow up with her while she was still in the hospital, post-op day 1 and 2. And although I did not keep documentation from that long ago about this, I do know that her pain levels were decreased and that her mobility had started to increase before she even left the hospital. And what's interesting to share is that the floor nurses were curious and very interested in what the visits were about. There was another Healing Touch student who was in the OR with me at the time, and she was very enthusiastic about going up to the joint replacement unit to see this patient, and gave a prime teaching opportunity for the other nurses there. And we shared the information about Healing Touch with the nurse manager there on the joint replacement unit, and we were hoping that their enthusiasm would follow through. But at that time, there wasn't anything in place, no avenues for educating our nurses at Christiana Care like there is starting to be now. And then Jane told me later that the physical therapy people that she went to visit post-op, this is her words, they raved about my range of motion and how fast her recovery was progressing. And Jane points to Healing Touch as part of that for her. So she is a perfect and probably very rare example of someone who came to surgery with her field well prepared in advance. And that kind of preparation, no doubt, contributes to a successful outcome, no doubt.
Great. Wow. Thank you for sharing that amazing story. And I loved hearing, from the beginning to the end. Wonderful. Wow. And how about you, Chris? Any success stories you wish to share?
There's one I'm particularly pleased with, but I also want to affirm too that joint replacement situations seem to really benefit from this, and it's very clear because of the symptoms that people have and the mobility they regain quickly that it's very, very helpful. My favorite story, my favorite experience involved two people, two women who were best friends, and one was donating eggs to the other. So I met with both of them each time, first with the woman who was donating the eggs, and the three of us worked together to do a ritual to promote an easy retrieval and establishing the reason that we were doing this work. It was a very lovely experience for all three of us. And then after that retrieval was done, we had another meeting of the three of us to create a safe space for the implantation. And I'm very happy to report that that little boy is 5 years old now. It was a very successful time, and the three of us were really thrilled with the opportunity to work together. It strengthened their friendship, of course. I mean, what a wonderful gift for a friend to give. But they were open to this work. They worked together beautifully, and I was really honored to be part of that process with them.
Wonderful, beautiful story. Thank you. And how about you, Linnie? Any success stories you wish to share?
I'm trying to think of the best one. Probably, I had a roommate for a while, and he went in for what he thought was going to be where they go up the from the groin up to the heart to put in an all right, boy, I should write all this stuff down like everybody else did. But anyway, they decided that they wouldn't do that, and the next morning he was going to have quadruple surgery. So he had another friend who did Reiki, and we were waiting in the waiting room together for him to come out of surgery, and there isn't any recovery. They just go straight from the surgery to the room. So we were in there, and it was the first time I had been in a situation like that, and I felt like I was in the cockpit of a 747. There was so much stuff around. And we decided in the beginning that since they had cut the sternum, that we would just hold our hands gently over him together and just let the energy go where it needed to go and set an intention for the highest good of the client. And I am kinesthetic, and one of the things is when I feel pain, it feels like I've put my hand in a bucket of sparklers is the best way to do it. It's a stinging sensation. It's a little unpleasant, but I'm not miserable for it, but it's a wonderful way to let me know what's going on. So we're holding our hands like this, and all of a sudden my hands went off. And I said to the nurse, I think his anesthesia is wearing off. And she looked at her watch and up at the clock, and she said, yep, you're right on time. She read some instrumentation, and she said, yes, you're right. It's wearing off. She gave him a shot, and I felt the level of the pain diminish as that went through his system. He recovered with the two of us working on him every day for about 3 days, had an amazing recovery. And everybody was quite amazed at how fast he recovered. And he came home much, much quicker than he would have otherwise. But the two of us working together in love for this one person, for me, said so much more than just the techniques, because he was Reiki and I was healing touch, but we were able to work in harmony together. And Ken just really, he's since passed away, so I don't mind using his name. And this was 10 years ago. Anyway, it taught me a lot about not to be prejudiced about other modalities. Healing touch is, to my way of thinking, one of the very best, if not the, but still, I learned to have respect working with another modality on how this works.
Beautiful. Thank you for sharing that. Wonderful stories.
And it's fun being validated. I have to share this. I once asked Janet Menken if she liked to be validated, and her answer was, yep.
Wonderful. Thank you. And as far as challenges you faced when working with these types of clients, or anything else that you think would be helpful for our listeners that are working with these types of clients. And Chris, did you have something you wanted to share?
Yes, a couple of things. One of the challenges that we face in this area is that the medical community is not open to integrative complementary medicine. We've been working with this for 20 years. We are in the Midland, we're in the Midwest. I'm envious of hospitals that will have programs like yours, Heather. And I hear about these stories all the time. It's not here yet, but we're working on it. Part of our role is to educate the public so that the public will be asking for these things, and gradually work with the practitioners so that they too see the wisdom of it. If I'm doing some work and there's a nurse in the room and he or she shows some interest in what I'm doing, I certainly tell them what I'm doing. I often have brochures with me, or I had a business card when I had a practice, and would share that with anybody who was interested. Some people seem to know about it. Some people seem to be completely unaware and uninterested, and we just let that be. But I've talked to a couple of people who were interested in knowing more and gave them information how to get that info. And even if their agency or their facility would not support them in it, it would be helpful for them to have it for the issue of intention and the issue of attuning and all the things that we've talked about that can be done without blowing your cover. So there's that. Another challenge, of course, has been COVID. I was able to keep my practice open during COVID because of the opportunity to do remote work. When so many practitioners of many kinds, particularly massage therapists and others, lost their ability to do their work. The remote work can be so helpful in a hospital situation, because if you aren't physically present, you aren't interrupting anything else that's going on. And also you can get around the patient, the person, so much more easily without getting in the way of equipment or having the equipment get in the way of you. So I found that to be a very helpful thing, and was able to work with people who were hospitalized during this particular plague we've been experiencing, which is going to be with us forever, I do believe. So remote work is a wonderful way to operate anyway, but for hospital situations, particularly if someone is in an isolation, that support and care and love can be given without being present. I think that's something that is very important, and I hope that people will reach out when they're doing their work to try it. I know it's a bit of a stretch to think about working remotely, but I have found it to be incredibly satisfying, and in some ways deeper work than when I'm with a person physically. I can't explain really why, but it's a deeper level of intimacy because there are no things in the way. Another issue is if you are in a room with a person and there's equipment on one side of the bed, or the bed table is there, just with intention, you can work on the other side. Make the motions on one side and have the intention to have it operate on the other side. So there are many ways to do remote work, even in a smaller situation. And I invite you to practice that until you become more confident with it. And I think you'll find that it's a very valuable way to work.
Wonderful. Thank you for adding all of those tips. And Heather, challenges or anything else you wanted to share?
Thank you. Chris, I want to just say that I understand the feeling of being suspended in that place where it's just not here yet. Because we have, so I saw someone ask, where am I working? It's Northern Delaware. And not for lack of community or healing touch support instruction in this area. I think it's generally the mindset of the medical community. And I've been on the East Coast my entire life and envious of what happens out in Colorado and down in Asheville and some other up in Portland, some more progressive people in the way they think. And so what I've learned in the past 10 years of chipping away at individuals, one person at a time, sharing, expanding, bringing awareness to all of these things. So as energy healers, we're well versed in the idea of creating a healing environment. So we imagine that calm and quiet and private space that's free from interruptions and distractions. And this place is usually a comfortable temperature and softer lighting, and perhaps some healing music or other types of soundscapes going on around. All of this enhances the relaxation response, which is what we want to begin that whole cascade of the physiological response of healing. So in this place, we are aware of and we acknowledge Kairos time, and we're open to the mystery and the wonder that happens. This is the place that we all like to be, myself included. And then we take healing touch into the operating room, and it feels like we're balancing between two worlds, and the dichotomy is striking. The surgical space is always cold, and there's reasons for that. There's bright artificial light everywhere, and the elements of metal surround, like everything from the furniture to the instruments. And sounds that are far from soothing surround the space. There's monitors, there's equipment, there's suction apparatus, there's power saws, there's power drills, there's things that make a lot of noise. And then there's the voices. There's a big effort to remind people in this environment to keep their voices low at certain points and to stop talking altogether at the induction of anesthesia, at the immersion of anesthesia. But still, for the patient that's having this experience, all of those sounds are already amplified just because of the medications and the stress of being here. And then, not to mention, everyone's wearing a mask, everyone's wearing scrubs, and pretty much everybody looks the same. So that that can elicit all kinds of feelings for anybody. And in addition, privacy just does not exist in this space. And to top it all off, Chronos time is the driving force behind everything that happens in surgery. So this, I hope, portrays like the contrasting image of what an ideal healing space looks like compared to what goes on behind the double doors. But there's ways to bring it through. And so OR nurses function as patient advocates. That's kind of what is taught in nursing school and in fundamentals. Nurses are patient advocates primarily. And that gives us a little bit of power, really, because we're there to support them physically, and we can also support them energetically. And so I hope I've shared some examples of ways to be flexible and adaptable in this environment. What I feel is really the necessary action step is educating staff, determining the interest in staff learning at least level 1 techniques, and having those conversations with patients too. So many people come into the hospital setting, and even if they were aware of energy therapies, they may not be aware that energy therapies might be available in any institution, or that they even have a right to ask or inquire about it. So this has been my vision for really the past 10 years, to find a way to bring together the two healing modalities that I'm so passionate about, surgery and healing touch.
Wonderful. Thank you, Heather.
Christine, I'd like to add a little something.
Yes.
In the Portland area, and it has nothing to do with whether you're a nurse or non-nurse, but for me to be in post-op and pre-op, especially pre-op, the client has to sign a form stating that I will be there. Otherwise, I can't get in. And I wanted to mention that because that's very important. The beauty of that is then it's on the chart. So everyone from the nurses to the orderlies to the doctors, they all know that I am going to be there.
Yeah, good point. Thank you for sharing that. Great. Well, now I want to open it up for questions. So feel free to write your questions into the chat, and I will go through those, and we'll see if our panelists can help answer those.
Christine, I have one cute little story I'd like to tell before we get into questions.
Yes.
Please. I love it when a doctor comes in when I'm doing my post-op work. And when as I said before, I'm kinesthetic. So when I'm doing an assessment, and let's say it's a hip operation, and partway down, I'll find the pain spike from the surgery. And I can tell how good the surgeon is by how big the pain spike is lots of times, or how pain sensitive a client is. It isn't always the surgeon, but the hand just automatically goes like this. And so I'll have the doctor run their hand down, and they haven't paid any attention much to what I'm doing, and the hand automatically goes like this, and he'll say, well, I didn't feel anything. And I'll say, do it again and watch your hand. And when they see this, their eyes get big as saucers. And then I'll say, if you come back in a half an hour, 45 minutes, you'll see a change in the field, because then it will be smooth all the way down. And some of them do come back, and it's helped doctors become aware that, yes, we do something, because they can feel it, whether they or they're not aware of the sense of touch, but they can see what their hand is doing as it goes over the pain spike.
Wow, thank you for sharing that. Okay, so questions. If you have any questions, please feel free to put it in the chat box. In the meantime, I'm going to add the email addresses of Chris, Heather, and Linnie in case any of you wish to follow up with them individually. I'm also going to share some resources. There's a couple books, and then I also put the name of that music CD that Heather mentioned. I'm going to put that in the chat as well. I will be including the email addresses and the resources with the recording. And so you'll be able to access them after this call as well, or for those that are listening in after the live call. And then let's see, there was a question which Linnie, you helped answer, but I wanted to see if Chris or Heather wanted to add anything to that. And the question was about doing magnetic clearing with intention to not clear the pain meds. Or their question is, or do you wait until they are not needing the pain meds anymore to do the magnetic clearing? So, you know, Linnie already kind of answered how she does that with intention, but Heather or Chris, anything you wanted to add about that?
No, that covers it. The intention is going to be strong enough to make it so.
Great.
Christina, there was a question about doing remote work and whether I use a surrogate like a stuffed animal when I do remote work. No, I'm much more literal than that. I have a treatment table at home, and I've put pillows and a ball on it so that there's a body. And it can be a little frightening when you come in the dark and there's a body on the table, but I have also filled a pair of gloves and a pair of socks with beans, so that if someone has something to do with a hand, I can work with the particular fingers or the parts of the hand that are affected. So I put a body on the table in literal form. Although I have heard that you can work very effectively with a stuffed animal, and that will work as well with intention. But I like to have the body there so that I can do what feels like a full assessment on them with hand scans and pendulum, and assess before and after. And it's just like having a person in front of you. It changes when you do this work. It's quite remarkable. I still have sometimes a hard time believing it, but experiencing it is believing it. And I recommend it if you have space to do something like that.
Great, thank you. Heather or Linnie, any thing you want to add about remote work and how you do it?
Anna Marie taught me when she used, and I've started using it since then. She uses it in her classes. She uses an ironing board and has all her students have an ironing board, and she puts a long sleeve shirt and a pair of pants and a pair of socks and gloves and a hat, and so you have your full body. And for a while I tried using that on my table, my massage table, but I'm so good at feeling where things are that I kind of gave up on that. But I thought it was a great idea, so I thought I would share it. You have a body there that's dressed.
Mm-hmm. Great, thank you. And how about you, Heather? Do you do remote work, and how do you do it?
Well, I will say that I did not have a whole lot of confidence in myself when it came to doing remote work. And because of the pandemic, I've actually done what Chris described, because I needed to see something that resembled a form. And I will say that practicing remote work more frequently lends to the confidence and the ability to see the results. It's not something that I do frequently, but in the past couple of years, the times that I have done it and then spoke to someone after the fact, it was remarkable that transference of energy happened.
Right.
Something I do too is I ask for the chakra when I'm pendling. I ask for the sacral, and in be able to see them when I'm one-on-one. I can see a chakra actually bend to the hand of the practitioner, especially of my students when they're way off the mark. But I never know what it's going to do. And here I am in space, and it's compromised. And in the next chakra, it's spinning nicely. And in the next one, it's spinning diagonally. It's amazing to see that. And I have no idea or preconceived ideas as to what I'm going to see at all. In a way, it's a very good way to help generate some belief in what we're doing, because it shows.
Yeah.
Boggles my mind. I hope I never lose the awe. I also want to point out, just as a point of interest, that when COVID came, about 80% of my clients did not want to do remote work. They really liked having the hands-on or hands close by experience so that they could feel the changes themselves. Although they could feel the changes when remote work was done, for those who decided to do it, I lost most of my clientele. And it's a harder thing to explain. I explained when they would ask how it works, I would say it probably works the way prayer works. You know, there are circuits that are going on that we can't perceive with our limited sensory equipment. And you just have to put yourself in the space of being loving and caring and working for the highest good so that no harm can come to a person, and make it so. And it really works. And yet that was a step too far for many people.
Yeah, thank you for sharing that. I will just add with remote work, for those of you wondering about it or haven't done much of it, is to play with it, right? Play with trying the stuffed animal. Does that work for you? Play with the, pretending they're on the massage table. I've also done it on Zoom where the person is laying down and they have their camera angled so I can see them, right? And I'm doing the work, that way. But I've also done it where, I'm pretending they're on the massage table. So it kind of depends, and do what works for you to be able to hold that space and that intention, right, for the client. Great, wonderful. I am also going to, let's see, there was one question in here. It was more for you, Linnie, regarding that form that you were talking about. So Jill had said that she has helped in surgery when introduced as a request based on the client's spiritual beliefs, which organizations have to, respect. But she's wondering if you know more about what kind of form in the Portland area.
Usually it's not a form so much as a physical note that the client has written requesting my presence. Now, to get into ICU, a couple of times I've had to use my minister license to get in. They weren't, not so much today, but 10, 15 years ago, it would be Reverend Linnie who made it in to do the work rather than Linnie as a certified instructor and practitioner. So it doesn't hurt to have that minister's license.
Great, thank you. I'm going to share a document that Heather put together. Let me see. I'm going to put it in the chat. Let me find it. But it's images regarding the operating room and kind of all that's involved. Here it is. So I'm sharing that in the chat so that you have access to it and can save it if you want to. I'll also be including it when I send out the recording. But anything you want to talk about with that image, Heather?
If you have time and you would like to share the screen and show the diagram rather than the art. Okay, they're together. On the top picture, where you see all the people labeled, in this picture, there are 5 people standing around a patient for surgery. There could be upwards of 9. And what I would just kind of like to highlight for just food for thought in terms of what every individual brings to that field, preceded by the question that I kind of left open-ended: what happens to the energy field when the consciousness is knocked out with general anesthesia or heavy sedative? That question today for me remains unanswered, and I'm actually gathering all kinds of information if anyone would like to share, and via email to me. But when I look at this picture, and because I've worked in surgery my entire life, let's just imagine for a second that there's a patient there, and it might be you, it might be a loved one, but say the anesthesiologist has a sick kid at home, and the surgeon's assistant had a flat tire on the way to work, and the surgeon's going through a messy divorce, and the scrub nurse has a hangover. What kind of energies does that bring to a wide open field that I believe is wide open and taking on energetically everything, could be taking on what is the energy of people that are participating in this operation. And this is where I come with the importance of maintaining our own vibration and doing our own self-care, so that when we step into the operating theater, which I believe it has been referred to since the 1800s, it's a theater where the actors step in and they perform their roles. So that's kind of what I wanted to share with that picture, in case there was any questions of how many people are there and what they do. And then in terms of the second picture below, this is just a beautiful image of where spirituality meets surgery. And it appears that there's been a trauma or a very difficult surgery, an attempt at life-saving. And as you can see, all of the members of the surgical team are affected, and they are sad, and they are feeling grief, and the one is holding the hand of the patient beneath the drapes, and one looks like he's about ready to collapse onto the floor, and yet you can see the spirit of the patient in the background. And I just get chills when I see this, and I only wanted to share it simply because of the power that's behind this image for me. And if there's any questions or anything anybody would like to share in viewing this, it's a very accurate picture of what it looks like in surgery in terms of where the placement of things are, and right down to the green handles on the surgical light. Yeah, I just wanted to leave you all with that. It's not a pretty story, but it's actually a beautiful image in its entirety.
Thank you so much, Heather, for sharing these. And I'm seeing lots of comments from people that these images are really helpful. And so thank you so much for sharing and explaining, why you think these images are helpful. So I'm going to stop sharing. It doesn't seem like we have any other questions at this time. So I just wanted to thank you all. Thank you all that came to participate in this event today. And of course, a special thank you to Chris and Heather and Linnie for volunteering their time and sharing such helpful information for all of us as we work with clients post-op and pre-op and even during surgery. I'm going to put my email address into the chat box in case anyone has any feedback or questions for me. You'll be able to reach out to me. Our next Healer Development Series topic is going to be on headaches, and that will be on Friday, October 7th at 12:30 Central. I'll of course send an email out as we get closer to that, so you can register for that event. And as always, if any of you are certified practitioners or instructors and you wish to participate in a future panel for this series, please feel free to send me an email and let me know what topics you'd be interested in. And we can get you onto a future panel. So thank you so much, and thank you for all the healing you all bring to this world. Bye.
Thank you, Christine.